As in many countries, most adults in our country continue their lives without realizing that they have chronic kidney disease. Although chronic kidney disease has various physical symptoms, people often think that these symptoms are caused by different reasons. In addition, people with chronic kidney disease tend to recognize the symptoms of the disease only towards the end stages when their kidney function begins to decline or when they see high amounts of protein in the urine. For this reason, only 10% of patients are aware that they have chronic kidney disease. The exact diagnosis of the disease can only be made with medical techniques. However, it is possible to mention 10 basic signs that may suggest kidney disease in the person. If you have high blood pressure, diabetes, and kidney failure in your family history, or if you are over the age of 60, it is important to have regular annual checkups for kidney disease. Make sure you tell your doctor about the symptoms and complaints you feel. If necessary, do not neglect to take notes of the troubles you experience before your doctor's visit. Now if you have chronic kidney disease, we said there are 4 important symptoms. We will tell you about them in a moment. Symptoms of chronic kidney disease. 1. If you are more tired, have less energy, or have trouble focusing your attention. A serious decrease in kidney function increases the rate of harmful substances, toxins, and pollution in the blood. This causes fatigue, weakness, and difficulty concentrating. Another problem caused by kidney disease is anemia called anemia, which causes weakness and fatigue. 2. If you cannot sleep. If the kidneys do not filter as they should, harmful substances that should be excreted in the urine remain in the blood. There is a link between chronic kidney disease and obesity, and this problem, called sleep apnea, is more common in chronic kidney disease than in the general population. 3. If your skin is dry and itchy. Healthy kidneys perform many important tasks. They remove waste and excess fluid from the body. They help to make red blood cells, keep the bones strong, and maintain the mineral balance of the body. If the kidneys cannot maintain the balance of minerals and nutrients in the blood, dry and itchy skin can be a sign of mineral and bone disease, often accompanied by chronic kidney disease. 4. If you feel the need to urinate more often. If you feel the need to urinate more often than usual, especially at night, this may be a symptom of kidney disease. Damage to the filters in the kidneys leads to an increased urge to urinate. In some cases, it may be a sign of urinary tract infection or prostate enlargement in men. 5. If you see blood in your urine. Healthy kidneys keep blood cells in the body while removing waste from the body by forming urine, but when the filters in the kidneys are damaged, blood cells leak into the urine. In addition to the symptoms that indicate kidney disease, blood in the urine can also indicate tumors and kidney stones and infection. 6. If your urine is foamy. Especially excessive foamy urine that requires you to flush the toilet more than once indicates that there is protein in the urine. These foams that appear when you beat the same egg are albumin, a protein that is usually found in urine and is the same as the protein found in the egg. 7. If you have persistent swelling around your eyes. Protein in the urine is an early sign of damage to the kidneys, causing protein to leak into the urine. Persistent swelling around your eyes can be caused by your kidneys leaking excess protein into your urine instead of keeping it in your body. 8. Swollen ankles and feet. Decreased kidney function leads to sodium retention, which in turn leads to swollen feet and ankles. Swelling of extremities such as hands and toes can be a sign of heart disease, liver disease, and chronic vein disease. 9. Decreased appetite is a very common symptom, but increased waste, toxic substances due to low kidney function, may be one of the causes of decreased appetite. 10. Your muscles are cramping. An electronic imbalance of fluids and minerals in your body can be the result of kidney dysfunction. For example, low calcium levels and poorly controlled phosphorus can contribute to muscle cramps. Explanation of kidney infections, stones, cysts, polycystic kidney disease, kidney cancer, and kidney damage. Yes, now we want to move on to another detail. How do we know if your kidneys are cancer, stone, or infection according to the pain of your kidneys? How does kidney infection happen? If bacteria reach the kidneys, they can cause a kidney infection. The most common symptoms of kidney infection include nausea, dull pain, burning and pain during urination, blood or pus in the urine, sharp pain, foul smelling or cloudy urine, vomiting, back or groin pain, chills and fever. It is important for people with these symptoms to seek urgent medical attention. Kidney stone pain. Kidney stones occur when salts and minerals build up in the kidneys over time, forming small deposits. These stones can grow over time. Small kidney stones usually pass through the kidneys and are excreted in the urine. Larger kidney stones can cause discomfort as they pass from the kidneys to the bladder through the urinary tract and can become lodged in the kidney or urinary tract. Signs and symptoms of kidney stones include blood in the urine, pain during urination, vomiting, nausea, and very sharp pain in the back or abdomen. Treatment of small kidney stones normally involves drinking fluids to reduce the stone and taking over-the-counter pain medication, but the pain can increase greatly in the process of passing the stone out through urea. How to recognize a kidney cyst. Benign or non-cancerous cysts are normally fluid-filled sacs. Kidney cysts can form in one or both kidneys and usually cause no symptoms. A cyst that grows too large, bursts, or becomes infected can cause signs and symptoms such as fever, tenderness or sharp pain in the area, or pain in the upper abdomen, sides, or back. Small cysts usually do not require treatment. In cases where treatment is necessary, your doctor will follow a treatment plan specific to you. Polycystic kidney disease, or PKD for short, is the name given to a genetic condition that causes one or more cysts to form in one or both kidneys. Polycystic kidney disease can change the shape of an individual's kidneys and lead to other problems such as kidney failure. Signs and symptoms of polycystic kidney disease include kidney stones, pain in one or both kidneys, urinary tract infection, blood in the urine, and high blood pressure. Tumors in the kidney may not cause any discomfort in the early stages. However, in later stages, as the cancer gets worse, pain in the side, back, or abdomen that does not come and go or becomes less intense may be noticed. Kidney cancer treatment methods may need to be applied for this condition. Vigorous activities that require contact, such as football, boxing, horse riding, or basketball, can put the individual at risk of kidney damage due to trauma. In such a case, the discomfort may be on both sides of the abdomen or in the lower part of one of them. Depending on the severity of the injury, the pain may be mild or very strong. Yes, in this video, we tried to tell you what are the symptoms if we have kidney disease. For a healthier life, please do not forget to like and share and subscribe to our channel by commenting so that others can benefit. We wish you all a healthy life. Goodbye.